Good morning. Good morning. What's up, fam? How you doing?
I'm good. Good, brother. Excited about today's episode, the season finale.
Same here, man. It's good
How
to
are
see
you, man?
I'm
Good
good.
to
I'm
see you,
good.
man. Yeah, man. I'm excited, man. I'm excited. Full of energy, man. I'm excited, man.
Same here. We matching each other's energy today. Good morning, Chicago and the rest of the world.
Indeed.
What is up? You are with the Money, Sex, Gen X podcast. This is season 4. This is actually our season finale. Why do you need therapy?
Wow.
And you are joined today. I am your host with the most, the man with the plan, the Scotty Pippen of podcast pimping. Mr. Eric McLeod, my team affectionately dubbed me E-Money.
E-Money.
So I will answer to both. I will answer to both. E-Money in the building. And I am never alone. I am joined by the titan of Team Tech.
Who that?
Music mogul in the making. Don't tell nobody though. The Rasheed Wallace of stock market knowledge. My co-host, the homie, Big Stu.
Bo. Lick a shot. What's happening?
Man, we're going to get it in today. We're going to cook up today. And if you're out there watching the season finale, if you like what MSG is cooking up, like, comment, share. As I started asking people recently, drop MSG 100 in the chat so we know you out there. You might not want to comment. Sometimes our chat gets real live. You might not want to comment, but drop one as MSG 100 in the chat so that we know you're out there. And hey, we did start, and this is from Big Stu, we started making the transition over to YouTube. So go over to our YouTube channel. All you got to do is type in Money, Sex, Gen X and subscribe or sub, as the young people say, sub our channel. Sub Money, Sex, Gen X.
That's good. That was good, man. Great job, man.
Yes.
Like that.
Yeah, man. So today, Big Stu, we're talking about therapy. And as we always do, we're going to drill down. We're going to get deep into the subject. And we do have an illustrious guest.
Wow.
Brother Mark.
Before we bring on our guest, I'm sorry.
Okay.
I think I'm doing this right. Am I not doing this right? Did we talk about the merch or no? Is that not?
You know what? We reorganized.
We switched it.
Hey,
Keep going. No. That's on me. I dropped the pass. Come on, Mark.
It's okay. It's all right. So, man. Brother Mark, can you bring out our illustrious guest today? Yes.
Dr. Roxann Sheppard-Samuel.
Man, we have a wonderful guest today. We have Dr. Roxann Sheppard-Samuel. Now, Doctor, I'm going to give the corporate sort of bio, and then I want you to tell the people who you really are. You can get a little deeper. But here's the corporate bio. So we got Dr. Roxann Sheppard-Samuel. Man, this queen is an author. She's an adjunct professor. She has a long list of accomplishments. She's a CEO, a field instructor. This is something that jumped out at me. She's an active member of her community, super important. She's a member of the church. She's a part of a sorority. Can you tell us again, shout out your sorority?
Yes, Zeta Phi Beta Sorority Incorporated.
Yes. Wow.
She's a licensed clinical social worker, so that's why we wanted to have this particular conversation with her today. 20 years of mental health experience. She actually has her own practice, which is called Passion to Purpose Consulting LLC, and it has a very clear focus: mental health and wellness. The practice is located in Queens, New York. Wow, this queen has a lot to be proud of, but she is also a mother of 2 young men. Love to talk a little more about them. She's a woman of Caribbean descent. She's also a first-generation college student. And something that jumped out at me, Big Stu, when I was reading this, is that the doctor is actually, she studied internationally at the University of Ghana in West Africa.
Wow.
Wow.
That's phenomenal. Welcome,
Yeah, I want to
Dr.
know more
Roxann
about that.
Sheppard-Samuel.
Thank you.
Welcome.
Thank you. Thank you.
And I just wanted, you know, in the pregame, we were even talking, and she is an avid. Well, I don't want to put words in your mouth, but you know who 50 Cent is, right? So you listen to some sort of hip hop. You got a little hip hop thing going on top of all of that. So thank you, Roxann, Dr. Roxann Sheppard-Samuel, for joining us.
Yes, thank you.
Thank you for having me. It's a pleasure.
That's the corporate bio. Who are you? Like, tell us a little more.
Okay, so who am I? Basically, I was born in the Caribbean, in Antigua. And when I came to America, I was probably around 6 or 7 years old. Was put into second grade twice because of my dialect. They couldn't understand me. And then my parents moved in the middle of the school year. So they put me back in the second grade for a second time. Nonetheless, I graduated from high school at 17. Went on to college. I went to SUNY Brockport, upstate, and had the opportunity to study abroad. I then left, came back to New York City, lived in Brooklyn for some time. And from there, I went into foster care and adoption. I worked with the Juvenile Justice Department with young kids who were being incarcerated, a lot of gang involvement. And from that point, my journey led me to also working with trauma victims from World Trade Center. So any survivors and surviving families. Let's see. And then from that point on, I went to work in an inpatient psych hospital as a social worker, regular line social worker working with adolescents, child and adolescence department. So these kids were anywhere from 5 to 17 years old. They were admitted. So I provided, therapy services and everything, discharge planning for them. Then I was promoted to the associate director position at that facility, working with the adult population. So the adult population includes just regular adult and geriatrics. So men, women, no difference. Went to work at a health insurance company. So that's how I was able to meet a lot of fabulous people and trained licensed clinical social workers, licensed master social workers on best practices, as well as just knowing how to identify symptoms that require inpatient, outpatient, and various levels of care. Let's see. So, and then from that point, I went back to the hospital as a request and was the director. And I oversaw 3 departments, which were the social work department, the therapeutic department, as well as the education department. And I stayed in that position for quite a few years, and then left and started my own practice and got my doctorate. So I'm a recent grad.
Congratulations.
So, and that's what it is. And to be, quite frank, I grew up in a poor community, in Queens. So my community, we called it Pop City, also known as Bricktown. So a lot of drugs, a lot of crime, a lot of fights. I was a fighter, believe it or not. So that's just what it is. And this is who I am.
You weren't going for it, huh?
Yeah, no.
I love meeting people. I like meeting people who used to fight. I used to fight a lot when I was younger, and people look at me and it's hard for them to believe. But it's like some people, like I was one of those kids, like you couldn't say anything to me, and you definitely couldn't touch me. We fight out the gate. You know what I mean? Like, but you look at me now, you're like, he wasn't fighting nobody. But yeah, so I like to meet other fellow ex-fighters.
Hey, yo, let's before we go too much further in, our second guest has joined us, and let's bring his introduction in, and then let him get a chance to kind of introduce himself. Let's get acquainted, and then let's really start to dig into some of what we're here to talk about today. So
absolutely, let's get it in.
There he is, Fonz the therapist. Good afternoon. Good afternoon. Where you on the East Coast, West Coast, Midwest? Where you at?
I'm over here on the East Coast. I'm right outside of Philadelphia.
There he is.
Okay.
That's what I'm talking about. We got Philly in the building. Philly in the building. That's what I like. I love Philly, man. Love Philly.
Yeah.
So what I'm gonna do is I'm gonna read your bio, and then we're gonna ask you to introduce yourself. We have Eric McLeod E Money is the host, and then Dr. Roxann Sheppard is our other guest. So let's get into it. So Alfonso, Fonz the therapist, is a black male licensed therapist, speaker, and author. He has clients all over the country. He's the vice president of Brightside Counseling. He's the co-owner of Brightside Medical Associates, where they specialize in treating individuals in various areas such as depression, anxiety, anger management, life coaching, structural family therapy, autism spectrum-based disorders, and sports psychology.
Nice.
So he's currently teamed up with Taraji P. Henson's Boris Henderson's Foundation to bring free mental health care to the Black and brown communities of America with their campaign, The Unspoken Curriculum. Now check this out. This gives young adults the ability to unload mental health concerns with someone, with someone that looks like them. That's Fonz the therapist. Welcome to the Money, Sex, Gen X podcast.
Welcome, brother. Thank you for coming on today.
Thank you for having me. I appreciate it. It's definitely a blessing to be on with you guys.
Yeah. So tell us outside of that. So tell us a little bit. You can give us a couple of minutes about you, man. Who are you, brother?
Absolutely. Fonzo Nathan, Fonzo therapist. I'm a jack of all trades. Try to be a master of all, but I don't know. We'll see. Like I said, I'm a licensed professional counselor. I deal with all types of mental health situations. I've been in private practice for the past since I was at the age of 24, 25. I've been in private practice, and it's just constantly growing. I'm happy to, in my earlier years in private practice, I was dealing with a much more affluent population, and then what I had to do was I had to look at myself, because there was this meme that came up on my timeline, and it said, "Black people go to jail, white people go to therapy," and that hit me hard, because I realized I was part of the problem, because I have all these skills, and I was giving it to individuals that didn't look like me. So I changed my whole setup, my whole situation to be part of a lot of foundations and organizations, to give my knowledge, to show representation for not only for the mental health, but also for aspiring mental health practitioners, that you can be successful in this field, and you can help others. So I for the past couple of years, I've been teaming up with different organizations to really push that and break the stigma for mental health. I'm an ex-football player, college football player. I know a lot of the college athletes, especially for the male football players. There hasn't been much platforms to be able to express yourself, because you're conditioned to keep everything in and act tough, and a lot of times they're the ones that struggle so much more. So I'm happy to be helping with those individuals. And one of my colleagues, his name is Jay Barnett. He's killing it out there right now as a black male therapist. He's been featured on a lot of different platforms, and we're teaming up with Taraji Henson and her foundation to help these younger kids to really understand. We got to break the stigma, and that's what I'm about.
No doubt. Beautiful.
Thank you.
Wow.
All right. So we have some heavyweight mental health professionals in the house today. So we're going to drill down into this topic. So before we dive in, we always like to talk about why we wanted to talk about this. And as we all know, COVID is still running rampant in the world, and everybody's been dealing with issues. Stu, people are dealing with jobs are being impacted. Family dynamics are changing. In many instances, people's living situations are just not what they used to be. They're having to adjust on a daily basis. And so, of course, mental health is coming into play more and more. As Fonz was giving his bio, I also thought about the fact that I feel like when higher income professionals, when they have mental health issues, I don't really know if they necessarily get the help that they need sometimes, because say if a person is making $200,000 a year or more, society would believe that, oh, you're okay. You're good. You got everything. You're making the money. You don't need anything. You're good. But we all know that that's definitely not the case, right? So say you're an entrepreneur, you're doing your thing, you make a lot of money. Those individuals have very special and unique, I'm sure, mental health needs. And so I want us to weave that into the conversation today as well. Now, you all are probably going to check me on this, but we always do, we try to do research before we come into every episode. We have a researcher, her name is Roxann. We call her our data scientist. Shout out to Roxann. She pulled up 6 things that I want to get your feedback on before we dive in. And her research suggests that there are actually 6 types of therapy. And let me know if you need to tell us that we're wrong or we need to add something. But she has that one type is psychotherapy, which focuses on interpersonal relationships. Psychoanalytic therapy, which is used for treating depression. Cognitive analytical therapy that emphasizes investigating one's past behaviors. Systemic psychotherapy that focuses on interaction and dynamics of people. Humanistic therapy, and cognitive behavioral therapy. Dr. Sheppard-Samuel, is that a pretty comprehensive list of the types of therapy that are out there?
Yes, it is a comprehensive list. You have some social workers, I'm a social worker, so I speak from the social work perspective. And you have some social workers who really tune in and focus more on one particular or 2 different types of therapy, such as mindfulness-based cognitive therapy, which is another way of looking at a person in the present moment. And basically with that, they couple that with cognitive behavioral therapy, especially when you're dealing with people who are suffering with anxiety and depression. So, and that's where my field is.
Okay.
Yeah.
And Brother Fonz, where is your, out of those 6, first of all, do you feel like that's a good list, and where do you focus?
Yeah, I think that's a good start. There's so many, there's a lot more as well, different approaches. But that's a good foundational start for myself. I use like we said, mindfulness-based therapy that really helps with a lot of my clients with anxiety and getting them in the here and the now, and also solution focused. And that's one, because a lot of times as a society we focus on the negatives and the problems, but what this type of therapy does, it helps you focus on the times when things are going right, and why is it going right, and how do we duplicate that. So we focus more on the positives as opposed to just the negatives and the problem. And also DBT, dialectical behavior therapy. That's the best one for trauma. So you know, there's a lot of different approaches, but the initial one that you had, that's a good foundation of it. But you know, each therapist finds their own type of niche for how they can approach the client or guest, and how I see it.
Okay. Now we always, Big Stu here, my co-host, sometimes he'll give us a moment of disclosure. Stu, I don't know if you're comfortable doing this, but I'll say something later on. But have you had the benefit of having therapy, and do you recognize which type of therapy that you may have had on this list here?
So yeah, man, I have therapy. I've had therapy. Absolutely. Based on this list, you know, I've had some therapy to address some PTSD.
Okay.
So I guess that would be what, psychoanalytic psychotherapy, I guess. Some separation anxiety.
Okay.
I've had therapy for, and continue to have. I'm in some family therapy right now. You know, so yeah, that's the extent of my involvement with therapy. Oh, and of course, I'm with I'm doing some personal group development therapy with Black Men Heal. So I'm involved in that kind of group Black therapy, Black men specific therapy. Yeah.
Okay.
Yeah.
What does that look like? How does that work? The group black therapy. Well, not even so much the fact that it's black, which is powerful, but like, how does group therapy even work though?
I think it's phenomenal. So right now it's happening virtually in over Zoom. But it could also happen. I could see it easily happening in person. But just bringing a bunch of brothers, a bunch of people that have the same interest and a safe space to share without judgment and to hear from people like Fonz, the therapist, black men that look like them, black women that look like them, share insights, share. That's what it looks like for me. And then you get your takeaways and then you work on it and you come back and you share, kind of drop in, drop out, no real ask, no real pushes, but that's what it looks like for me.
Okay.
Fonz, maybe you have something you want to say? Or
Absolutely. Again, big shout out to Black Men Heal. That's one of the organizations I work closely with, and it's a great organization. It really helps break that stigma for our Black men to be able to express themselves. In King's Corner, that's what I'm assuming that you're talking about every Sunday. Mm-hmm. It's just a safe place to be able to talk about certain topics. Every different week they have different topics that you may want to address or talk about, and they have these guest speakers like myself or some other professionals to be able to have the Black men just to be able to feel comfortable that they have a professional opinion, but also it's like a brotherhood type of ordeal. You know what I mean? Okay. I like group work because it makes you feel like you're not alone. Especially for sure. Black men, sometimes you feel like these thoughts and feelings that you're dealing with, you're the only one that's feeling like that. And then when you start, hearing other people having some similar type of situations that you're dealing with, it kind of feels like, okay, I'm not alone. I can be able to, work on this and process this, and it's such a great dynamic. So big ups to Black Men here.
And to your point, these are men who are educated and high positions, upwardly mobile, high value men who are self-aware, who are conscious, who dealing with a lot of stuff. So it's cool. Yeah.
Beautiful. I'm about to check into that.
What about you? What is your experience with therapy, Eric?
Yeah, I've had the same types of therapy that you've had. Unfortunately, I feel like a lot of times I had the therapy too late. So I was introduced to therapy by going to couples relationship therapy in a prior relationship. The relationship, you all, was completely gone. There was no way to salvage it by the time we got to therapy. But it was like a last minute ditch effort to try to make something happen. It didn't work. But after that, once I was clear that relationship was over, I started meeting with that same therapist one-on-one. And it changed my life because she began to focus on my own behaviors and attitudes. And so it was a life-changing thing. And I began to promote therapy ever since. Now, I want to drill down, though, because we have a lot of younger people that are listening to this show throughout the world. Let's go back. Dr. Sheppard-Samuel, could you please define what does the term or the concept therapy actually mean? What is therapy? How would you explain it?
Yes, I will explain therapy as the opportunity to go and express any concerns that you have. I think in society, especially when you look at a textbook and the textbook defines therapy one way, I want people to understand that if you're having any problems in your home, in your marriage, at work, it doesn't really matter exactly what that problem is. It's an open space, a safe space for you to actually be able to get an unbiased opinion, not even an opinion, someone who's unbiased to really sit and listen to you and to help you work through whatever problems it is that you're bringing to the table. It gives you a different perspective. It allows you to look at things differently. And what I'll do is I will go into cognitive behavioral therapy because that's where my specialty is. And that's really talking about, how you think. That therapist is sitting there and basically analyzing your thoughts, what's coming out of your mouth. What are you saying? Okay. How does that relate to how do you feel? So if you think one way, you're going to start to feel a certain way about how you're thinking. Definitely. Then you're going to behave according to that feeling. Okay. And as you know, feelings change from minutes, seconds, hour to hour, right? Definitely. So we should not operate on our feelings.
Right.
Okay, so when you come to therapy, what is therapy? Therapy is a safe space for you to really unload whatever it is that you have in your head, what's going on. And like, I want people to understand that sometimes years and years of holding on to a lot of stuff does not free up that space in the mind for you to start to think clearly about what's happening in the here and now. Because sometimes when we go through a lot of things in our lives, we're still thinking about that stuff, yet we're still trying to process what's happening now. And then now we're also we're looking in the future. So we just want to make you understand that, get the stuff out of your head so you can actually focus on what's happening right now.
No doubt. My therapist, when I began to do the individual therapy, an exercise that she had me do was to count the ceiling tiles in the room, the tiles on the top of it. And before that, I didn't even know that I wasn't in the moment. I thought I was absolutely in the moment. And once I started counting, I'm like, oh, you're not in the moment. And so once she was able to, like you're saying, once she was able to bring me into the moment, that's when the magic started happening, because Eric was in the moment. Now, Fonz, sir, I wanted to ask you, so Dr. Roxann Samuel said that she defined what therapy is. I'd like for you to kind of tell us, how does it work? And some, maybe from the perspective for people who haven't had therapy yet, what does that dynamic look like?
Yeah, absolutely. That's a great question. I think everybody has a different reason why they're going into therapy. So everybody's experience in therapy is going to be fairly different. But the thing that is really important for everybody is understanding the importance of what we call the therapeutic rapport or therapeutic relationship between the client and the therapist. Because if you don't like me, you're not going to want to listen to me. If you don't like me, you're not going to want to talk with me. So for me, like the first session or two is just really about getting to know you and letting you know that, you can trust me with what you have, going on. And so it's usually a session is about, 52 minutes to an hour. And I break it down. And again, I do it different. I may do it differently with others, but I break it down just like that. The initial like 10, 15 minutes is kind of just like, seeing like how the week was and just kind of, unloading or so. And then a good portion of that time from, 25 to 30 minutes is really maybe introducing some new things to you. And then the last bit is like summarizing. That's usually how I break it down. But sometimes, again, it's all different. If somebody just really needs to unload, I let them unload. But I never just, if it's 10 sessions of somebody just talking, them just talking and me not saying anything, I don't find it productive, because they have to learn something from me. You know what I mean? Right. So any conversation I have, I try to make sure that they leave from my session with some extra knowledge. Not only just like unloading and unpacking, which is good for for a certain amount of sessions, but you got to learn something, because the real work is not done in session. The real work is done outside of session.
So, and that's a good point. That's a good point. It's a good point. Because I always felt like, and I got that point later, but when I was in these sessions, I would always feel like the session went by so fast. Exactly. It's like as soon as I started talking, Stu, it's over. And I'm like, man, what am I supposed to do the rest of the week?
Exactly. And that's what sometimes we fail to realize, that is that inside the session is artificial. You know what I mean? This is, in the real world, you're not going to have me, kind of coaching you. It's like, okay, what do we need to do for this week? Okay, like, what's your plan for this week? What's some homework for this week? What do you got to be aware of for this week? And that's when I started noticing that people start getting, getting better, because they know, okay, I have to work on, making sure, I'm not giving my energy to some emotional vampires this week. You know what I'm saying? Right. And so when you start working on that and you come back and we process, hey, listen, before my mom was real draining. Now I didn't give her my energy and I'm feeling a lot better now. And we process through it. That's the real work,
Doctor, I see you nodding, and I'm wondering, so this sounds like it's a very serious endeavor, but are you able to introduce humor into your interactions with your clients?
Absolutely.
Or is it all serious?
No, absolutely. So I'll share with you what a session with me would look like, right?
Okay.
Okay.
So,
Okay.
and I'll use the proper terms. So the client comes, whether it's virtual or in person. Okay. And what we do is really just have a conversation, right? We get to know each other, especially this is the first session, warming up. All right. Because I like Ifan says, the client has to want to be there. You have to have a
Yes.
connection with the client.
Right.
So there has to be, it's a two-way street. And when I do a consultation at first, I let the clients know. I said, you're interviewing me as I am interviewing you. Because not every therapist is equipped to do everything for everyone.
Okay.
Okay.
I
So
want to talk about
just
that
like
more.
how we're not here for everybody. We're only here for a set of people, right? So when the client comes, you know, we dialogue. I want to get to know who this person is, right? And I want to see how much the client is willing to share with me. And I do not a full, but somewhat of a mini assessment, because I want to know what your problems, what's your immediate problem, what's happening with you currently, right? And I want to know a little bit about your past. Okay. So, and then I also want to know from the client, what is it that you want help with? Because I need you to tell me what you want me to help you with. Okay. And 9 out of 10, it always evolves throughout the session. You know, they come with one thing, and then by the time they don't, sometimes they don't even want to leave, to be honest. I'm sitting there and I'm telling them, listen, you got to go. I'm done with you. We finished. You can fly. You've earned your wings. You're good. And they come back with something else.
Right.
You know what? And it's a blessing, because like my brother says, we're here to take away that stigma. You understand? We want people to come in here and feel comfortable. And one thing about our people is that it's something that we haven't done historically. So we want to make sure that the platform is open, it's sensitive, it's culturally appropriate. You can identify with me, I can identify with you. And like my brother said here, you have some people who are working professionals, you know, and you also said it, Eric, working professionals, sometimes they're the forgotten ones.
Absolutely.
Always think everybody got it together because we're established.
No doubt.
You understand? So my practice really also focuses on those working professionals. You know, I got engineers, scientists, you know, you name
okay. Yeah.
You know, that comes into the office and they have their safe space.
Okay.
I have a question if I can jump in here. So let's talk about one of the things I hear stigmas, stereotypes is, you know, I hear people say, you a certain age, you're supposed to know certain things. Right? But there's certain things you're supposed to know, or, you know, you're a certain age, you still operate or act like the mind, like you're 20 some years old, or like you're a teenager. Like what is the expectation for someone who seeking therapy to get over something from their past? How do you process that?
Great question.
Yeah, that's definitely a good question. I think everybody has a different timeline, and I think everybody, you know, trying to get someone to get over, you know, something that's been plaguing them for 15 years. It's not going to happen overnight. You know what I mean? So I don't push people to hurry up and, you know, get over things, because we don't really, you know, you don't really get over certain situations. You learn how to deal with them. You know what I mean? So you have to look at it in that aspect of you know, what you're trying to teach these individuals. And everybody comes into therapy in different levels, different times, and different situations. So you know, there may be somebody that, you know, that's like a 12-year-old that's dealing with some certain situations. So we have to, you know, I have to do like 6-7 years of unraveling. Somebody that's 50 years old, I have to do like maybe 40 years of unraveling. So it's going to take some time on the healing process. And so it is about the buy-in. You know, the more bought in you are, the more likely you're going to see even more progress.
Yeah, that makes a lot of sense.
Yeah.
One thing that I keep thinking about as you all are dropping these jewels, and let me let the people know where we are. This is the Money, Sex, Gen X podcast. You are rocking with us on our season finale today. This is this is season 4, episode number 7. Big Stu, I can't believe we made it this far, but this is
we made it.
the finale. We're going to drop season 5 in a couple of months, but we're very, very happy to be here with 2 heavyweights in the mental health game. But one thing I wanted to ask you all is, I know from doing studies that most sciences originate from Africa. I know a lot of people will get upset about that. Certain groups might get upset, but that's my understanding based on the research that I've done. I would like to know, is therapy something also that was rooted in Africa?
When you said therapy rooted in Africa, explain that.
So the science of mental health, did it begin in Africa, in the continent of Africa? Or is this a Western science that we just all have adopted?
Well, that's a great question. And I would say that it all depends on the terminologies that you want to utilize, right? Because healing has begun way back.
Great point.
Right? So again, because of Caribbean descent, we had our ways of healing, right? And it was not necessarily talk therapy, right? It was more holistic, more ritualistic. So when you look at the Africa perspective, yes, we had rituals that we will go through, rites of passage and so forth. So when you're focusing on the therapy piece, the Westernized folks will say, yeah, we do more of the talk therapy. Africans or Caribbeans, we will say, no, that's something that we don't do that much because we think all of that, you're crazy. That's what, that was the stigma in the Caribbean. Oh, he's going crazy. Look at him. He has to go to a crazy house for somebody to go help him. You know what I mean? That's
right.
That's what I know. Right.
Okay.
But if there was anything going on as a church body, as a spiritual body, we will come together and we will sing songs, we will heal, we will preach, we will pray.
Yeah, that makes sense. Fonz, what are your thoughts about that?
Yeah, I mean, that's a really good question. I definitely agree with Dr. Sheppard-Samuel. I think it's all about the perspective and the context of like we said, with healing. We've always had healers. I think the words and terminology is more westernized, like with psychology and all these other big name words. But to helping like as a community, helping out each other. I think that's always been part of our roots. I'm from West Africa, so but we're always very big with like family meetings and family roots, and like that's just pretty much family therapy, but over the years, there are certain stigmas that have been laid, with sweeping things under the rug and trying to forget about things, as opposed to in a westernized situation where we're trying to really, deal with it and process through it. So I think it started, for obviously everything started with us, back in the day. But I think, as time goes on, it's been sharpened throughout time to go with the times, so because, now there's this thing called Maslow's hierarchy of needs, right? And the basic needs is like, it's just like, food, shelter, security. When you don't have that, you can't really talk about things that's going on in your mind because you have your basic needs you have to work on. They tried, in Liberia, years ago, we had a civil war, and after the civil war, they tried to give mental health help for a lot of these people, but they were like, okay, yes, I'm sad, but can you give me some food? You know what I mean? Like, I'm not thinking about my sadness. I'm sad because I'm hungry. You know what I mean? So a lot of the times, we see more psychology and mental health in more of these highly developed countries because we have the opportunity to be able to think about other things as opposed to shelter and food and stuff like that. So that's why we see this more in these westernized situations. So again, it's all semantics. It all depends on how we look at it.
Yeah, I love those answers. That makes a lot of sense to me. The healing, just the fact that the concepts were always out there. They might look a little bit different, but it's all about healing at the end of the day.
Absolutely.
Beautiful. Now, we titled this episode, Why Do You Need Therapy? And we all know, of course, that the reasons that someone might need therapy will vary. But I wanted you all to talk a little bit about some signs that you might need therapy. Before I ask you all to answer that question, I'm just going to give you like why I kind of felt like I needed it in certain situations in the past. Anytime it got to a point where I felt like my strategies weren't working, that's when I personally felt like I needed therapy. And I know everybody has their own mindset, but it's like I'm a very strategic person. And I feel like most of my strategies work in my life, but there are times where it just didn't work in romantic relationships, and sometimes with parenting my children, it just didn't work. And so that's when I knew. But I wanted you all to talk to people, especially the younger people out there, about like as they're moving throughout their everyday life, what's some things that they need to pick up on that may suggest that they need some help healing? You want to take that one, Dr.
Sure. All right. So some of the signs that you need therapy can be simple signs of, I'm just not feeling like myself. I don't understand what's happening. And it's similar to what you said. When the things that you normally used to do, you're no longer doing them. You're not having pleasure in things that you once did. You find yourself sleeping a lot more. You find yourself eating more or not eating or any sort of disruptive sleep. Those could be signs that you need therapy. If you're finding yourself to be irritable, you have mood changes. 1 minute I'm all right, and all of a sudden I'm just, or if you find that you're feeling that way specifically with one person or within one group, sometimes that could be a disruption in certain things that's happening for you. Other times that you can tell if you need therapy is if you're just not focused. If something is weighing on you so much and you just can't focus on getting your work done, or when you're doing things and you just can't finish them, because sometimes we have that energy and we have that motivation, and all of a sudden we start a task and we find ourselves not able to finish these tasks. What's going on? What's happening? Other times that you may need therapy is if you're just isolated. You once were this vibrant person, and all of a sudden you find that you just don't want to do anything. You don't want to go anywhere, and you just want to just be by yourself. So those are some signs.
Yeah, I definitely agree with that. What I would say is just, if it interferes with your daily living, if something's interfering with your daily living, that's when you need to seek dire help. But I'm also going to push for everybody to go to therapy. Just like everybody needs to go to a doctor, you know what I mean? When, everybody should be going to a doctor at least once a year to get a checkup. I think that we have to put mental health in that type of light. Same thing as physical health. I go to therapy once a month, and I do that to help me be able to, again, unwind and be able to, just to make sure that I'm helping out as many people as I can, because you can't help others unless you help yourself, right? So I think it's important for everybody to at least have access to an outside personnel to be able to go, help with their daily living.
So even therapists have a therapist.
Absolutely.
The doctor better have a doctor, right?
Yeah, I gotta practice what I preach. I can't be all stressed out and then I'm like, I can do this on myself. Then start telling people, you need to seek help. You know what I mean? So as therapists, for me, actions speak a lot louder than words. When people see me, lifestyle wise, and just like how I'm dealing, like then they feel more comfortable. Because like it's like getting diet and tips from somebody who's like really unhealthy. They're like, you don't believe it.
Right.
I mean, I have to make practice in my self-care. I'm groomed. I'm energetic. I'm feeling good. Because that makes people believe that, okay, this person is practicing this lifestyle. The things that he's saying, all right, maybe I can listen to.
Great point. Stu, I think I cut you off, brother, accidentally. But were you about to make a point?
Well, hopefully you all. I'm having some. Can you hear me? Okay.
Yeah.
Okay, good. So is there? I hear you. Everybody needs therapy. Dr. Roxann Sheppard-Samuel, Fonz, the therapist. Who's good? Who doesn't need therapy? Like who would you say? You know what? Who who in the limelight that we would know would you say, you know what? That type of person, they don't need therapy. That's the goal. Who is that?
That's a good question.
I don't know. When you find out, you let me know.
Okay.
To be honest, I think everyone can benefit from therapy. Just like Ifan says, you got to use it like it's your medical. Like you go to your regular medical doctor. And one of the things is it's a regular checkup.
So like I'm thinking, you know, in my mind when I thought about it, it's like, you know, Oprah doesn't need therapy, right? But then we're all saying, right, that's the point that I want to make. Like, even Oprah needs therapy, right?
No question. You probably need it more than we do.
Well, Oprah probably goes to therapy. When you're in a higher status, like now you have access to doctors. It's more about, you know, when we're in the people who are in need, they're the ones that don't have the access to therapy. Oprah probably has access to the best of the best. So if she's not feeling the best, you know, Dr. Phil or somebody else is gonna hit her up. You know what I mean? So a lot of these individuals that talking I see, you know, they have access and it's less of a stigma compared to when you feel like you don't need it because you may not have the funds or the time. Oprah has a lot of time, you know, so she can be able to work on that. Chris Rock said on an interview, he goes to therapy like every single day. He has
crazy
therapy. Yeah. You know what I mean? So when you have that accessibility and that time freedom, you can be able to work on yourself.
Yeah. Absolutely. Yeah. And then also to add to that, I would say that, you know, and I'll use myself as an example. There was a time where I experienced a trauma in my life, and I literally went to go see a psychiatrist because I felt that I needed that level of intervention in order to get myself back on track. And these things one of the things that I want folks to understand when it comes to therapy, it's not long lasting. And it doesn't have to be long lasting.
Right.
Therapy could be short term and it could also be long term. You can come in and see your therapist for a couple of weeks and feel like, okay, you know what? I got my problem resolved, or I'm able to function with whatever it is that I have, and then leave, come back maybe a year or two and say, listen, something else came up and the tools that I learned is just not working for me.
Right.
You know, so I just want to share that as well. And when you, Big Stu, when you mentioned like Oprah, I mean, like Tahaji mentioned about seeing therapists, you know, so we do. And a lot more of the stars of those people that are, you know, affluent, they're now sharing their experiences, which is wonderful. Yeah. And one last thing, Ifan, you had mentioned something regarding access. And that's a big problem for our community. Mm-hmm. You understand what I'm saying? And I'll put it out there. I have fought with insurance companies because they don't want to provide our people the appropriate access. They want to allow them to choose whoever they have in their network, which doesn't always reflect our people. And when I hear it, if someone calls me and says, listen, are you in network with so-and-so? And I said, no. And if I get multiple phone calls, I will go and call that insurance company and try to get on the panel. Because for me, if we have insurance, use the insurance. You understand what I'm saying? Use it. But when someone is not able to use it, it's a problem because now they don't have the funds to come and pay out of pocket. So now they're a little bit now deterrent from getting help. They just be like, you know what, forget it. I'm not doing that.
Yeah. Right.
So access is the issue.
Absolutely. I gotta ask you all this. I want to lighten this up a little bit. Y'all dropping some heavy jewels out there. I'm sure some people out there taking notes. This is a globally listened to show, which is great because we don't know who all is going to be touched by this information. But I'm gonna lighten this up a little bit. Most of the professionals that I deal with, many of them, including myself, when you're just hanging out with your friends and family, just trying to relax. Do you all ever, like, for example, I got a friend that's a lawyer. She'll be just kicking and hanging out with her family, and they'd be like, stop trying to bring law into this conversation. Stop trying to lawyer me. Or for me, they'd be like, stop trying to financial advisor me. Like, let's just talk. Do you all go through that when you're just trying to chill and you're not even thinking about therapy, but you might just say something and your family is like, yo, don't psychoanalyze me. Just don't, you know what I mean? Do you all go through that?
Absolutely. When I would go like and meet new people, I wouldn't tell them I'm a therapist because what happens, what I've learned now, what I've noticed now is that every time I walk in a room, it kind of changes because people are on like trying to be on their best behavior. I feel sometimes like some like pastors and preachers feel sometimes when they walk in and everybody's like, "Hey, pastor, how you doing? You know, I'm doing good. I pray." And like sometimes again, before, you know, I'm a very like laid back person. You know, I try to say I'm funny and stuff like that. Like, so when I try to say jokes, sometimes like now because of platforms I'm on and like what I do, people don't see it as jokes. They're just like, is he serious or is he laughing? And like, I'm like, man, am I not funny no more? Or is it because like I'm a therapist, but I think that I'm always like analyzing them. And like once I'm out of the chair and things like that, listen, that's turned off. You know what I mean? Because I'm not gonna go ahead and be like, you know, give you free therapy, because at the end of the day, like that's my bread and butter. So if somebody, you know, maybe wants to ask me a couple of things, I'm not even gonna go fully in there, because it's like, all right, if you need something, here, I'll give you a referral or anything like that. So I just be chilling. But you know, again, it definitely feels different when you're walking in the room. So
now, how much of that is self-inflicted versus the reality? Now, I don't want to overpsychoanalyze. I'm not about to try to reverse psychoanalyze you, but for real though, like, you got a superpower. Y'all got superpowers now. I know there's some people like, yep, they could use my services. Yeah, let me slip you my card, right? Like,
yeah, but I turn it off because everybody can use our services. I'm like, okay, all right, you know, I just turn it off, because in my earlier time, I would be like try to like save the world and be like, all right, you need therapy.
Okay, that's what I'm talking about. That's
for real. That's real.
You learn that it was like, okay, that ain't gonna get it. Let me just fall back.
Yeah,
can't save the world.
I just be.
Doctor, how does that look with you? I mean, I know you got 2 boys. Are they accusing you of that? Or how does that go?
No, actually, you know what? Thank God, my boys they're wonderful. Like, they actually give me therapy sometimes, because, you know, I think the great thing is that when I walk in the room, it's almost like a magnet. Somebody just knows, and I could be on vacation and they'll come to me and ask questions, and I'll be more than happy to answer the questions and, you know, keep it brief. But for me, when I'm out of the office, I like to have a good time. I'm not going to I don't have time to worry about what's going on in your head, because I'm worried about what's going on in mine.
There you go.
You know what I'm saying? So I don't even look at it that way.
That's great. It's good to know that y'all are real people. Now, I try to remind people, everybody's a real person. At the end of the day, you got to deal with your own stuff that's in your own head. And I'm glad that you admitted that you get funds, that you get your own therapy. Because that is super, super. Even for the pastor, the teacher got to have a teacher. The pastor got to have a pastor.
Coach got to have a coach.
Coach got to have a coach.
No doubt.
You know, I live by this book of Malcolm Gladwell. What got you here won't get you there. And it's for people who are already high achievers who are aspiring for more. And the title says it all. Well, what got you here is not enough to get you there. And sometimes you just need somebody else that can help you get over that hump. And that's how I see therapists. Now, but Dr. Roxann Sheppard-Samuel, I want to ask you a question, because I didn't know the difference. What's the difference between a therapist and you said you had to go see a psychiatrist?
Yes.
Yeah,
I thought that was the same. Like, what's the difference?
Okay, so a therapist can be a licensed mental health counselor, a licensed clinical social worker. They can have different, like a psychologist. Now, the difference is a psychiatrist is the only one that can prescribe medications.
Oh, okay.
So there was a moment in my life where I had a serious injury, a trauma, and it just consumed my entire life. So I went to a psychiatrist and I spoke to the psychiatrist. And, you know, based on our conversation, you know, I was just recommended to just see a therapist, work through it. And I have my own therapist that I go and I see every 2 weeks. And a lot of it now is just really just to talk about, you know, just decompressing whatever it is that may be happening for the last week or two. And that's about it. And I share that to let everyone in the audience know that we all need help. You know, regardless if we have these titles, we have these degrees, we're still people, we're still human beings. We still, you know, for those of us who are spiritual, we still worship a God or energy or whatever you worship. And we still need that support. So
No doubt.
don't be afraid to go out and ask for help. Right. I believe Big Stu said it when, you know, when he referenced the book that he's reading. We all need help. What brought you here is not going to get you there. Not at all. Because things change, times change, and people change. And as you can see, what happened within the last year of this pandemic, who would have ever thought? You know what I mean? And one of the other things I want to mention within this pandemic is that our younger generation, our kids, are suffering as a result of this pandemic. I mean, the suicide rate for young kids, 5 to 11, 5 years old to 11.
5 years old.
Parents are wondering, what could you have going on? You know, but trust me, that isolation, that inability to be in community, you know, and all the other things that's happening within the school system and the structure or lack of structure. There's so many reasons, you know, and then they may be even in homes that have history of violence. So we want to really look out for our children and even ourselves, you know, the Gen X population, you know.
Yeah, I was going to ask you about that. So I wanted to ask both of you all, from your point of view, do you think that Gen Xers are participating in therapy more or less than millennials, for example?
I would say less. The millennial population is the one that will come out and really seek help. I feel like Gen X, we're still stuck in that era where it's kind of like we just got to get it done. There's too much going on. I don't have the time. I don't have the patience. I don't have the money. I don't have the resources. I'm just trying to stay above water. You understand? And that's the part that I want people to understand is it's not healthy. You understand? To keep constantly running and going and like I think Oprah and Yana always say your cup half empty or half full and all that. No, you want a full cup, right? So, but when you're giving, and that's what we do as Gen X, we give to our time, we give our resources, we give, and it depletes us sometimes. But we have to get to that point to say that, you know what, I need to see somebody, I need to live and not just exist.
And I think that's why spaces like the Black Man Hill and King's Corner are so important, because a lot of us, you know, some of us are underinsured, uninsured, and you know, whether it's $50 a session or $125 a session, $50 a session, you know, we just haven't prioritized it financially. And so King's Corner and Black Man Hill gives Black men the opportunity, if they can't afford it, to taste the water, if you will, to determine who's even out there to trust with your stuff. Right? And so, okay, I got a list. I didn't even know that I would get a list of 4 or 5 Black male therapists. I had no idea, you know, that there are that many Black male therapists out there. And so, Dr. Roxann Sheppard-Samuel, I'm hopeful that we can continue to find affordable ways to give our people access to the therapy, because you're right, more people, in my opinion, need it than don't. And we can all benefit from it. We got to destigmatize it and make it accessible, more accessible, in safe spaces. So that's my 2 cents.
Stu, I like what you said. That sounds like another T-shirt.
Come through.
Who can I trust with my stuff?
Who can I trust with my stuff? That's what new T-shirt alert coming next week.
I like
Who can I trust with my stuff?
Make sure I get one.
Yeah, definitely.
We will do that. We will do that. No doubt. Now we know we don't have you all. Unfortunately, we know we don't have you all forever. So I want to hit a couple more points before we let you all get back to your day. But one of the things, and you all are helping the culture tremendously, as you always do every day. But today is special because I know that there's some young people tuning in that told me they were going to tune in that needed to hear this. But I wanted to ask you all, so we've defined what therapy is. We've defined the origins of therapy. We've talked about some of the signs that maybe you need a therapist. We've even given some examples of where we've actually all participated in therapy. But one of the things I had as a question is, do you all as practitioners think that therapy is evolving? Is the practice of therapy actually moving forward? Is it evolving? Is it devolving? Do you think it's staying the same?
Oh, it's definitely evolving, as it should be, because people's mindsets now is a lot different than it was 20 years ago, 30 years ago. Even access to it, telehealth wasn't really that popping until, prior to pandemic, but like 10 years ago as well. So I think therapy, like anything has to evolve. If not, it's going to be obsolete. Just like if it doesn't evolve, it'll be like Blockbuster and Nokia.
Right, you out.
It's no good. So I think just the approach, the representation is starting to change. I always encourage a lot of my Black men. Like I was the only Black male in my entire program for graduate school. You know what I mean? And I'm like, there's a lot of white women here. You know what I mean? And I was the only one. So I'm encouraging like my younger Black men, my Black kings, this is a great field to be in. I have a very, 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 very comfortable life. And a lot of times people can go in this field because of the stigma of, oh, this is just a working for it, which is definitely not the case. And you can help people out. So I think the representation has been changing, and just like the approaches have changed. DBT wasn't really a thing until 5-10 years ago. Like, so there's more. So it's ever evolving. To answer that.
I like how you brought up the fact that, we can start considering going into mental health. Like if you go to law school or B school or stuff like that, people will always give you a suggested path. Doctor, if somebody's out there watching this and they're thinking about becoming a mental health professional, what's a path that they may be able to take to get to that point?
I would tell them to be a social worker. I'm sorry.
Social worker, okay.
I'm a social worker. So you go through your bachelor's program and you can study anything. I have a bachelor's degree in psychology and African American studies. And then you move on and get your master's in social work. You take your licensing exam. You get supervised for, your 3,000 hours. And then you become a licensed clinical social worker where you can now have your own private practice. And for me, just like Yvonne says, is like, I'm a CIFI certified in supervisor. I supervise interns from the master's level schools. Okay. And basically I teach them how to engage, how to do therapy, how to do treatment plans, how to prescribe a diagnosis. Because that's one thing within my field that not all social workers are able to do, is that I'm able to give a diagnosis. So I can tell if you have anxiety disorder, generalized anxiety disorder, if you're, schizophrenic or whatever the case might be. So I encourage our people of color to get into the social work field. And I encourage them to continue on. One of the things that I've noticed is that when we get into the field, up until that LMSW level, it's a challenge for Black people to get beyond that. It's a challenge for us to get those 3,000 hours, because in order to get those 3,000 hours, you have to have a qualified person who's willing to sign off on your paperwork. And oftentimes we go into some of these fields and the person who's supervising us don't have the credential. So you kind of get stuck.
Right.
And again, when we look at all the different, structures that are out there, it kind of blocks us, and we need more of us. I encourage everybody, get whatever, if it's a licensed mental health counseling degree, go get it. Be the best of the best, be the top of the top, because you can do it.
You can do it.
Sure. Piggyback off of that, I want to encourage to look into what we call a psychiatric nurse practitioner.
Yeah.
Okay. So a psychiatric nurse practitioner can also prescribe medication, management. So anybody who may be in a nursing field and may be interested in psychology, it's another route you can do, and it's really good money. I mean, I have a medical practice, and I employ about 4 psychiatric nurse practitioners, and 2 doctors. The doctors are way more expensive, and so a lot of the nurse practitioners are the ones that are getting the work, and that's a growing field that you're going to start seeing in these next 5 to 10 years, because psychiatrists are very hard to find, and they're very expensive. So a lot of people have been looking towards looking to get med management from a nurse practitioner. So.
Why are the psychiatrists so hard to find?
because the graduate school, they only accept a certain amount of psychiatry in their medical program, and it wasn't until recently where mental health was really respected. It wasn't until these past couple of years where people wanted to go into mental health. So we'll see a rise in that probably in the next 10 years. But for right now, if you want to get into the mental health field a lot quicker and also make really good money, people have been going in that type of route. Myself and my partner, we wrote a book on just how to successfully navigate a private practice. Representation for those fields, I highly suggest.
Okay. Wow. Well, you all, we're rounding home base here. I got to get this in though before we let you go. Every week I have something that we call Eric's burning question. And this week is no different. I have a question. If you feel like it's too controversial, we respect that you might say I will pass on that. But my burning question this week, you all, is this. So, Doctor, you said that you have a Caribbean background. Brother Fonz, you said that you have a West African background. My burning question is, do African Americans have different overall mental health issues and needs than you would see of someone from a Caribbean or African background, or is it just people are people?
Mm.
Are there any variations there? So say I'm from Jamaica or I'm from Haiti or somewhere, like, do I typically have other...
You talking about some predispositions?
Predispositions or just unique sort of needs that maybe the African American might not have, or vice versa. Say, I think me and Stu are both straight up African Americans, for example, but because we've been here our whole life, do we have a different psychological profile than somebody who came here from Haiti 10 years ago? Like, is that a thing or is it not? I'm just wondering.
Yeah, I mean, I definitely believe so. It's more of a cultural situation, because for Black Americans, looking back, a lot of the history is lost. So a lot of the history, only began with slavery. So and it wasn't until like recently where we're trying to find our roots and everything like that. But the cultural competency is definitely different because I know from me, my family came over from West Africa, so our customs were a lot more different. In that aspect, a lot more. We knew that we had a place back home. You know what I mean? So a lot of felt fortunate part for Black Americans. They're like, they didn't see a lot of their places from back home. It wasn't until like 23andMe where you can kind of really, look at that. But that roots that a lot of us have, it's like, okay, I can be like identify for like, my family hundreds and hundreds of years ago, thousands of years ago. I know where I came from, and it can kind of put just a different type of just, belongingness. You know what I mean? So the mindset is different, and then that aspect. And it wasn't until, in reality, it wasn't until Black Panther came out where it was cool to be African. And that's the reality of that.
Dr. Roxann, Dr. Roxann, you studied African American. She studied African American studies. Is it African studies or African American studies?
African and African American studies.
African American. You studied this. I'm interested on your Fonz. Thank you. I appreciate your insights. Great answer. I'm also interested to hear from Doctor who kind of studied this. What's your take on it? Are there some predispositions, some variables, some nuances based on just where you're from?
Absolutely. I mean, culture plays a significant role in our everyday lives. And when you look at where a person was born, where a person was raised, that is going to be something that's ingrained in them as they move or transition from place to place, because now they get acculturated wherever they are. So now it's a fusion of these two cultures. And now you're thinking about, okay, back home, this is what we do. We don't think about these things. We just push through. Here is different because now it's something that's open. It's something that's discussed. It's something that's talked about. So let me get involved in this. Let me see which angle I'm going to use. And for the person who is from either the Caribbean or from Africa, sometimes that could be a tug of war because you don't know which way to go. Should I go and see therapy? Well, what are my family going to think? What are people going to say about me? You understand? So I would definitely say that the culture has a lot to do with it. And I do feel that people who are from the Caribbean or from Africa do look at therapy a lot differently than people who are here in America.
Okay.
I think the stigma is a lot stronger in the Caribbean than in Africa.
Okay. Now, I noticed you all's initial reaction when I asked that question. Is that something that you all have discussed publicly before? Is anybody, you've talked about that before? Okay. So it's not something that you haven't talked about. Doctor, have you talked about that publicly before?
All the time. I mean,
okay.
It's definitely something that you grow up with, because when you actually see someone in your family or someone in your community or from your culture who could benefit from therapy, and they was like, no,
don't want it.
Kind of know where that taboo is coming from.
Right. Okay. Well, thank you all for joining us. I just want to ask you all to do one last thing. If you could just leave the people with something to kind of wrap up this conversation in the context of, why do you need therapy? I think Brother Fawn said that everybody needs therapy. But just leave it with a little nugget before you transition out. Doctor, you want ladies first? You want to do ladies first? All right.
What I would say is it's not okay just to be okay. We want to be the best that we can be. What I would say is anytime you're feeling any sort of discomfort and you feel like there's something going on, especially when you can't talk to friends and family, just reach out to a therapist. Find a therapist of color if that's who you're if you feel more connected to. Therapy is for everyone, as it was mentioned, and don't be shy. We are here for you. We want you to come out. We want you to live your best life. The whole saying, live your best life. And we want you to get a lot of things that's on your chest off your chest. And that's what I would say. Seek out a therapist, and we're here for you. And for those people who are entering into the field, come on over and become therapists, become social workers, because there's over 1 million people, and 1 million Black people who have now sought out therapy.
1 million. Okay. Now, I know Big Stu is going to get me if I don't do this, but could you let us know where the people can reach you on your various digital platforms? How can they get in contact?
Yes. So I can be reached on Instagram at Passion to Purpose, PASSIONTO Purpose 16. And email, I can be reached at Passion to Purpose 16. Actually, my website is passiontopurpose16.com. So
passiontopurpose16.com. Okay. All right. Thank you, Queen. Brother, can you give us your final thoughts?
Absolutely. I usually do final thoughts with in quotes, so my one quote for people trying to go into this field is the meaning of life is to find your gift, but the purpose of life is to give that gift away. That's from Pablo Picasso. And so if you know that you're a healer and you want to help people, this may be this is the field for you, and so don't block God's blessing, the blessing that He gave you. And then for the people that that are that should be going to therapy, you have to realize that a smart man learns from his own mistakes, but a wise man learns from the mistakes of others. So meaning you don't have to deal with these things by yourself, and you have to go through every single bumps in the road by yourself. You can be able to get the advice from people who might have been there or who have worked on this in order to really help you out. So those are just a couple of things I want you to leave from. Just know everybody needs a little an ear to listen to.
Indeed. And where can the people connect with you in the digital world?
Absolutely. You can hit me up on the gram or Instagram at Fonz the Therapist, Clubhouse at Fonz Therapy, TikTok, Fonz the Therapist. Just Google Alfonso Nathan, Brightside Counseling, Black Men Heal. Boris Henson Foundation, anything like that, you guys can reach me. And I'm always available to give out some free gems and just to help people, navigate where they need to be.
Absolutely. All right. Well, thank you, Queen. Thank you, King. You all showed and proved today. A lot of people are going to see this.
All right. Can I add one last thing?
You definitely can.
Thank you, Stu, as well. I just want to say, for those people who are looking for therapists, you can also look at Therapy for Black Girls. I'm also listed there, and Therapy for Black Men. So those are all platforms that you can find people of color who are doing this kind of work. So I just want to say thank you, and thank you to the both of you. It's a pleasure meeting you at Fonz, and this was absolutely amazing.
Yes.
So that's it.
Very powerful. Salute to both of you.
Salute to both of you.
You have a go.
You all do the same. Man.
Wow.
Talk about jewels being dropped.
We did a July 4th on May 30th, bro. We brought the fireworks. You dropped bombs.
I learned some stuff today, man. I always say that, and it's always true, but my views about therapy are definitely broader now. Definitely broader.
Wow, no man. Wow, this is it was a smooth conversation, man. It wasn't judgmental. It wasn't, it didn't feel preachy. It felt good. It was easy to hear this conversation. It was very, very informative. I can't believe time is up. Like, I could have kept listening. Like, it was great questions. Great questions.
Yep. It's beautiful.
But I'm sure that
I love when people
No, go ahead.
No, I would say I love when people are cold at what they do. You can sense when people are really, really good at what they do because they're just very humble. You know what I mean? Their whole thing is like, we're good at this, but we want to give back. I would give you several different platforms to get up with me. I just really like that. It's inspiring.
That was good stuff, man. You want to go back and let's do a comment check?
Yeah, I was wondering what was going on in the chat.
Oh man, we had a lot of great stuff. Mike Tyler just said, "Great session."
Run through
it for us, Mark. Run through. Let's even the old ones. Let's go through them.
I hope we can get Mike on
the
show at some point too, man.
And thank you for sharing, Fonz. Mike, that's an open invitation to you. Betty says, "Way to go, Dr. Samuel." Nadir Muhammad, shout out to E. Fonz. It's not E. Fonz. It was the @sim. Mike Tyler, initial conditions is calculus, would say variables. I think that was around the conversation that you asked, does your where you come from make a difference?
Yep.
Great interview, Betty said. Great question, Mike Tyler. Survival mode, Mike Tyler. Great interview. I'm enjoying this. Great interaction today. You can't save the world, right? Access to is very important, right? You got to practice what you preach. Self-actualization. Yeah, man. Yeah, rites of passage, semantics. Yeah, man.
Yeah,
what's up, man?
And you know what? I got to do this,
same in tactics,
brother. I got to mention the fact that Betty from over at NelsonCareerCurators.com is the one who brought us Dr. Sheppard-Samuel today. She made that connection for us. So thank you, Betty, to you and your team for doing that. Now we know this heavyweight in the game, so we appreciate that. Thank you.
Thank you. Great show.
The chat was popping today, so that's good. That's good. NelsonCareerCurators.com if you need some executive coaching.
Yeah.
That's who you need to call.
She's the professional career coach therapist.
Absolutely. Every coach needs a coach, and she's there to coach the coach.
There you go.
So, Stu, I think we got a raffle that we need to talk about and some merch.
This raffle, the competition was none. So all you had to do was enter once and you won.
Okay. All right. So
and we have that winner. We have that winner.
All right. We got a winner.
Shout out to Hey, look, the raffle open to anybody, man. $1 is $1, man. I don't care.
$1 holler.
I could have won the raffle. You could have won.
I should have put it in too then.
Man.
I could have got me another hoodie.
Man, you could have got
don't have
something.
a
You get
champion hoodie yet.
dang. You should have put $1 in. I'm putting $1 in next time. So we got to
put $1 in right now. Can I?
No, it's too late. No, you got to do it for next. No, it's too late now, man. But that's a come up, man.
While you was talking, huh?
Man, that's a come up, man. That's a come up, man. We got a winner this week for a free item off of our merch store. Why don't we pull up what's on the merch store anyway before we announce our winner? That's the new junk. Stay right there for a second. You're only selfish to people who can't get their way with you.
That's cold, brother.
That's off the Wisdom Wednesday edition.
I love when you do this on black. The black ones, those are nice, man. They pop. Oh, man. I like the baseball tee too, but that black one, I like that.
The color, that's the color. The colors of the brand. Mm-hmm. And we got another one. We got a new one that's gonna drop next week. Even though it'll be on this, we're gonna keep dropping joints. We got there's the mug, the red pipe and black pipe.
Red pipe and the black pipe. Yep.
Yeah. Throwback. Oh, this is the other one.
Eating better. That's the other one I want.
He's in the eating better. Yeah.
And it's a champion joint. Okay.
Mm-hmm. A few of them. The socks. I gave the socks away as a gift. My lady loved the socks. I have that. I got that joint right there. Okay. I got that. That's nice. We got some nice merch. Still stay masked up, y'all. Stay masked up, y'all. Stay masked up. Backpacks. I finally got that tee for my lady.
Oh, you did?
They like finally got the t-shirt dress for her. That was nice.
Okay. What color did you get her?
The little mauve. Right, I think it's a mauve in there, a little natural mauve. Yeah, these joints nice. I might. My lady does a lot of working out, man. So she likes leggings. I might have to cop her the leggings.
Yeah, that would be nice.
I have to cop her the leggings, John.
Those are bold.
Yeah. I might have to cop the legging jumps for her. Mm-hmm. No doubt. Yeah, man. We got some nice merch on there, man.
Yep.
So
support the MSG platform. It's not about us trying to make a buck. We're good as far as that, but we want people to just help support the brand, support the platform, MSG. Buy a hoodie, buy a t-shirt, socks. Help us represent out here.
It's the brand. Hey, Mark, if you were to buy something off of here for yourself, what would you buy? Show us what you would buy. Mark, shout out to Mark, who's our production manager, director of production in the background.
Killing it.
I want to see which one he would buy. What would he buy off of here?
The mug. He'd
buy the red piping mug. One of the piping. Oh. I'm sure he'd go with the red piping.
Right.
He'd buy the mug. He'd buy. Okay. Right. Wow. Okay. Well, guess what? Guess what, E? Guess what, Mark? He already knows. We had one entry for our raffle.
Lava Boy,
aka Lavelle, is our raffle winner this week. Right, and he wins an item off of our store, off of our merch store. So he's gonna get the mug with the color, the red piping.
Congrats.
Yeah. Congrats.
Help us push the brand. Oh, he said nice shirts.
Mike, well, cop you one. Show us it's a nice one. Cop a couple of them.
Right.
And enter into the raffle. Go to Cash App, $MSG podcast. Enter $1. Enter $1 for a chance to win a free item off of our store.
$1 holler.
$1. Just drop it at the MSG. Drop in the comment section. Drop your email. Drop your phone number. So we know it's you. We ain't gonna cheat you, man.
Yeah, y'all know how it is. Y'all know how it go down on other people's platforms. So help us out. And we got one more, fam. We got one more set. We got two more segments we got to get through.
Yeah.
One is characters from corporate. I think you're gonna like this. I'm gonna run through that real quick, and then we got our pool artist of the week, which is always solid. Can't wait to see who that is. Let me dive into this real quick. Characters from corporate. We try to give up a little bit of corporate game. If you're just tuning in, sometimes you might be like, man, why should I even watch MSG? For what? I'm busy. And what I would say is, man, we drop a lot of jewels, man. I mean, if you're in corporate and you're trying to navigate, this is a way for you to submit your situation or your story and get some feedback from two seasoned people We've made every mistake imaginable in corporate. We've also we've had some successes, but we give a little feedback. So that's characters from corporate. So this week, our entry says, hello, I'm 35-year-old man from Staten Island.
Shout out to Staten Island.
Shout out to the Wu-Tang Clan from Staten Island. Shout out to Staten Island in New York City. Brother says, I love characters from corporate, so I thought I'd write in. Okay. Because of COVID, I've been working from home for a year in my small apartment. I worked for the city of New York, and recently they encouraged me to get the COVID vaccine, so I got it. Okay. My first day back, I took the Staten Island ferry into the city. I don't know if y'all been on the Staten Island ferry. Comes in the Battery Park in Lower Manhattan. And he says, then I took the train to the office. He says, I started getting anxious on the way in because so many people did not have on masks. But when I finally got to my cubicle, before that, I passed by a few other people that I knew, but I didn't stop to check. But they did not hesitate to come over to me all day long trying to hold conversation. I know people are saying that they got vaccinated, but I'm still hesitant about talking face to face with people without a mask.
Wow.
All right. And he says, the second day I was about to head out for work and I had a panic attack.
Indeed.
I called in and told my manager that I needed to work from home. She insisted that I come in. I hung up the phone, waited a few minutes, and then I called back and just said I need to call out sick. Am I a character from corporate, or is my manager just being insensitive? Stu, what you got to say about that? COVID, man. COVID is not gone. Brother, he's coming from all the way from Staten Island. He's riding the ferry, riding the train, running past all these people. No telling how many people he passed to even get to the ferry. You got to get off the ferry. No telling how many people you pass to get to the train, even though there's a train station right there. But still, you're walking past people. They don't have on a mask. Then you finally get in the building. They don't have on a mask, but they want to talk. Stu, what you got to say?
My ego wants to say, man up. My ego wants to say, man up, dog. You know, shit, you got to live, man. What you tripping? You got the vaccine. Why are you tweaking? That's what my ego want to say. But the true self is, I'm siding with dude, man. Come on, man. Man, come on, man. Nah, man, I ain't been out. I ain't all these people. I'm surprised he made it day one. He made it the whole day. Woo,
yeah, man.
woo. PTSD. Oh man, the anxiety levels. Yeah, man. I'm borderline germaphobe right now.
Yeah,
you know,
man.
my people be my family will tease me that I got OCD right now. So I feel you, bro. I'm out there. I want to man up. I want to, but I'm like, man, I ain't been out. I've just been around my family. I ain't really been around even my people, you know, and it's just close family. And then day two, so he made it through day one. And he was gonna hat up and go in for day two. Anxiety, man. Anxiety got in his head. You know, I can't do it. Look, E, let me tell you this short story, man. Yesterday I went out for the first time. I went out in a social setting, the most ultimate social setting that you can imagine. I went out with a group of people for dinner.
Man,
the first time since that I've been out to a group of people with dinner since 2020, January of 2020.
Yeah.
And yesterday was the first day that I went and met a group of people that I didn't know and haven't seen ever before, except one person that I haven't seen in 20 years.
Oh, wow.
And so I manned up. I'm like, okay, push through. Bro, I got that. I was itching. I was like, woo! Some people had on masks, some people didn't. I was just like, whoa. Drinks is being passed. It's like, people eating and talking. I'm like, oh my gosh. Oh my God.
About how many people was it?
This is about 9 to 10 people. About 9 to 10 people at the tables. Not no 6 feet. No 6 feet. No 6 feet. I'm like, okay, I'm trying. So the fact that he made it for day 2, but he had that panic attack. I feel him.
Yeah, man. I feel him too. Man. I remember that day you did that, and this was only the second time that you and I met in person. But we went to that promo shoot for MSG, and I was tweaking that day. I was like, I was happy to see you. I was happy to see our PR team, but inside I was just like, man, I was afraid. You know what I'm saying? I'm like, man, I hope I don't infect my family and all kind of stuff. So I get it.
And then we bring in new lives into the world.
Yeah, man.
You know, and I get
different level of responsibility. So
now you talk about protecting them. You don't want to bring nothing back to the crib.
No doubt.
No, man, dude is not a character from corporate. I want to say, forget that job. Forget that job, man.
Yeah, man. I mean, and the other thing I was going to say is, hey, you know, just because they don't have a mask on, if you do feel like you do have to go to work at some point, you can keep your mask on.
Yeah.
You know, that might help a little bit. I know it doesn't help as much if everybody's not masked up, but you can wear your mask.
Bro, if you get COVID, you know what they're going to do? Find somebody to fill your job, brother. They're going to, you know. Yeah. It's like, we're sorry to hear it. I would be sorry to hear it, but you know what? Let me call you back. Somebody's calling your line. I gotta answer this phone.
Hey man, to that point, you know what? I read this. I don't know if it was a credible news source. I can't remember, but some article was saying that the federal government has stated that the employers, they can mandate that you get the vaccine. They can say you got to get it. So that means if they're going to mandate that you got to get the vaccine, they're basically saying you got to come back in the office. That's the next logical step, right? Why would I have you get vaccinated just to stay at home? So if that's true, we're about to see a major shift in society if employers can say you must be vaccinated to stay employed at this company. Then they're going to say you need to come back to work, just like with this gentleman. So it's something to think about.
Who's policing it? Who's policing whether or not? Do I have privacy? Where's the privacy? Like, do I have to disclose publicly with you that I've been? So now we got health requirements to work, which I'm not saying you got to go to school. You know, maybe this is the right thing. You know.
No, you're right, man. I read an article about that too, fam. It was saying that there's some inherent privacy issues that's going to be coming up. Because my thing is too, just because you say you got vaccinated doesn't mean you actually did. Like, everybody's going to say they've been vaccinated, especially if they don't want to wear the mask anyway. So how do you show and prove? And then at that point, there's a privacy issue. If I got to show you a card or something saying I've been vaccinated, isn't that a privacy breach at that point? You know, otherwise, but I feel like it's coming to that, because how would you know if somebody really was vaccinated other than their word? So we're in an interesting world right now, interesting environment. It's going to be interesting to see how this plays out. You're not a character.
You're not a character.
Keep yourself safe. Continue to keep yourself safe.
Please do, brother. Yeah.
All right, so that was characters from corporate this week. That was an interesting, thought-provoking one, and I think we got a pool artist. I can't wait to hear who that is.
Yeah, man. Go to musicspool.com. All right. A lot of great music. We've got a live event coming up June 17th at the Promontory, by the way.
Oh, really? Okay.
Yeah. Capacity is only 60 people. You got to be masked up.
Okay.
You know.
Tell us more. What kind of event?
It's open mic featuring 2 live artists from Pool.
Okay.
Wells, Mattingly, and O Plus the Prince.
Okay.
It's right before Juneteenth. It's shout out to my man Herman Joseph Rome, H2O, who is producing the event on behalf of Pool and with his company,
nice.
So Well Productions. And he's also an artist, but he's really big on these live performances. So he's really, really encouraging Pool to open up and have these live performances again.
Okay.
give artists a chance to hit back to the stage. So it's our second live event of 2021. We'll be bringing more. Pool will be bringing more live events. This is an exclusive event. It's at the Promontory, and there's only a capacity of 60 people. We'll stream it as well.
Okay.
But if you're interested in getting out and you're in the Chicagoland area, you want to go to Hyde Park, Thursday, June 17th. Doors open at 7. You can sign up if you got the talent. You want to get on the open mic. Check it out.
Thursday, June 7th. You know, there's one of
June 17th. Thursday, June 17th.
I'm sorry, June 17th. Okay. And that's musicspool.com. Now, I see one of your artists a lot, heavy. I see this guy a lot. He's on your platform, and he's been on the show a lot. We play his songs. Gino Pacino.
Love him.
I see him all the time now. He's coming up. I don't know if it's an algorithm thing, but I see him a lot. I really like his work. I like it.
Yeah. And, you know, part of success is when you say you like his work, you like his, I like his work ethic and his consistency. Okay. And those are two amazing ingredients for guaranteed success. Having a great work ethic and consistently putting out quality product, which Gino does.
Yeah, so. He's doing his thing, man. Shout out to him. Thank you, sir.
Yeah, so yeah, man, we're gonna listen to it's a therapy Sunday. Pool Artist of the Week. I'm gonna share the screen in just a second here. Okay.
While you're doing that, if you're tuning in, we do have a free download this week. 7 reasons that you might need a therapist. So go download that and take a look and see what's going on with that. I think that would be a great resource for people.
Okay. All right. Free download. Check it out. We're going to listen to H2O. He's got 7 tracks on here. And the song we're going to listen to today is Oh Man. And so here we go. All right. Man by H2O, Pool Artist of the Week.
Let's go.
I'm gonna say it. Yeah. They think they stopping my zen. They think they blocking my wins. They on the opposite end. Sometimes the opposite your friends. This here is not for pretend. I'm thinking about copping the biz. I just be saving my dough. Actively saving the hood. Got no time for saving these hoes. I might just marry the game as far as sanctity goes. Light up some dank in this bitch. Shots. Flash, bank in this bitch. I flow a river, put bank on it, ayy. Something so pure you could dream from it, ayy. I used to pray for this, dream of this. Now I'm the one that they sleeping on there. Low key the swagger so secretive. And every time I speak, I'm leaking it. Ay. Jump out the gym, you can't leave with them dudes. Don't even jump, you get put on the post. That might buy me some ice, cause I got the juice. Just enough rope for you to hang a noose. You better off just aiming for.
You gotta, you know how I like to leave you hanging. You got to go catch the rest of that on the platform.
Yeah, that reminds me of a Tribe. I don't know why it made me think about Tribe.
That's a great reminder then, man. Yeah, that's that vibe, man. Chill Sunday. Nice. I was imagining myself driving down Lakeshore Drive, north or south, approaching the buildings and the lake, sun, moon roof back, arm out the window. You know, in my Range Rover, you know what I'm saying? Driving down Lakeshore Drive, bumping that, you know what I'm saying?
Yeah, man, I'm feeling that. Yeah. I almost start freestyling, man.
Damn, man.
I really did. I'm like, man, okay.
Yeah, that's what's up.
Great artist.
Yeah, check them out. Mm-hmm. Well,
all right, man. It's been another banger. I mean, we definitely explored this topic of therapy today. I learned some stuff. I think you did too. Most importantly, like a lot of younger people, or maybe it's the older people the older people seem like they need it maybe more in our age group. As they said, the millennials are getting help.
Yeah, it's us old heads.
We helping somebody younger, but maybe today we helping ourselves. Gen X.
Wow.
Come on, Gen X, represent, man. Go get
Come
that.
on,
Go
y'all.
get that help. We got 2 heavyweights that would love to talk to you. But yeah, beautiful episode. This is it for us. I think we're gonna redo our real estate episode at some point, and then we're wrapping this season. It's been a beautiful ride. I love it every second of it.
Amazing. Even I have no complaints. Hey, y'all, I'm gonna tell you this. Look out for what's coming down the pipe. That's all. Thank you for helping. Thank you for being here with us. Mike Tyler, super Gen Xer.
Day one. He's been a day one. I remember he was hanging out with us on the first season.
Yep. Betty Nelson been thorough the whole time.
No doubt.
You know, it's been great, man. So Nicole, we got Nicole Carter on the DMV. We actually brought her on the show. She's so plugged in.
That was a good one. She dropped some jewels on the relationship tip. What's up, Nicole? Yeah, that was good. That was good.
Good season.
We just getting started. We cooking up, but our best meals have not been presented yet. We are cooking up. Season 5 is gonna be ridiculous, man. I can't wait.
Hey, look, man. It's Memorial Day weekend, and shout out to everybody who fought in any war on our behalf, particularly Black soldiers. Shout out to y'all, Black soldiers.
No doubt.
Shout out to everybody. My people as well.
Yep.
No matter black, it ain't just black. Anybody who's laid their life on the line for our freedoms in this country. Shout out to you, no doubt. That's no cap. But shout out to you. Shout out to you, Black soldiers, for real. Appreciate y'all.
No doubt.
But I'm going to get on the grill, man. I'm literally. I'll upload the rest of this later today. I'm like end it and I'm out the door. I got to roll.
Same here, man. I'm gonna talk to one of my homeboys and then I'm out the door. So I hope you have a great time with your family, man. And I will talk to you soon. MSG people will holler at you next week or week after that. When we doing that makeup one, man?
We'll talk about that. But no, we're gonna talk about that offline. Straight up.
All right. We don't want to make no promises that we can't.
Right. But this is the wrap of season 4. The season 4 is wrapped. It's wrapped.
Now, you wrapped. All right. We'll holler at y'all soon. Peace.